Hello, Morgan. My name is Michael. Thank you so much for agreeing to do this. I'm going to do a health history and also a head to toe assessment on you. Okay, so first, can you tell me why you came in today?
Just a general assessment.
Okay.
Mhm.
Can you tell me any of your past medical history?
Yeah. I've only had hypothyroidism
Hypothyroidism.
Mhm.
Very good. When did that start?
about 8 years ago.
Okay.
Mhm.
Do you have any history of like hospitalizations, any trauma, any other illnesses? No. How do you have your immunizations?
Yes, I do.
Yeah. Are you up to date on those?
Mhm.
Okay. How do you feel like your general health is?
I feel like I'm pretty healthy.
Okay.
Mhm.
Can you tell me do you take any medications?
Yeah, I take Synthroid 0.05 milligrams
How often do you take that?
daily.
Daily.
Mhm.
Very good. Do you take any other over-the-counter medications?
Mhm.
Any herbal supplements? No. How long have you been taking the Synthroid?
About 8 years.
Since the diagnosis.
Mhm.
Okay. Do you have any allergies? None to medications or anything like that, to food or anything?
Mhm.
Okay. Can you tell me what you're doing to help maintain your health?
Yeah, I exercise. I try to exercise at least 4, if not more, days a week for about 30 to 60 minutes.
Very good. What type of exercises are you doing?
I do some resistance training mostly, but it's pretty high intensity, so I get some cardiovascular in there too.
Nice. Get nice and strong and fit, huh?
Mm-hmm.
Very good. Do you can you tell me a little bit about your family health history?
Yeah. My dad has hypertension. He takes medication for that. And my mother had breast cancer over half a decade ago.
Okay.
And then my grandma had breast cancer.
Okay.
Mm-hmm.
Do you know of anything else, like any like heart problems or like anybody with diabetes or anything like that you know of, any neurological issues that you know of? Okay, very good. And you said your mom had breast cancer.
Mm-hmm.
And you said about over a decade ago. Okay, very good. Do you have any? Can you tell me about what you do for work at all or anything?
Yeah, I work at Wendy's.
Nice.
I work like 4 8-hour shifts a week.
Oh, very good.
Mm-hmm.
Do you work around any chemicals or anything like that?
Not really. No, nothing strong.
Okay.
Mm-hmm.
Do you what do you like to do for fun?
I like to exercise. I like to hang out with my friends and family. Pet my dog.
Nice. How was your relationship with your family?
Good. Yeah.
Do you feel safe at home?
Mm-hmm.
Is it that? Are you living with your family?
Mm-hmm. Yeah.
Very good. Now tell me a little bit about have you traveled anywhere recently? Or
Yeah,
anything?
I went to Italy in April.
Oh, very nice.
Mm-hmm.
Very cool.
Yeah.
Do you drink alcohol at all?
Sometimes, but not a lot.
Okay. Smoke at all? No. Any other like recreational drug use? No. Any history of like STDs or anything like that?
No.
No. Okay. Now I'm gonna ask you some questions about just your general health. Okay.
Yeah.
Do you have any fever?
No.
Any chills? Night sweats? Any sleep disturbances?
Mm-mm.
Any changes in your appetite?
No.
No. Okay. Any now like with your head, any headaches or anything?
Mm-mm.
Dizziness? History of head trauma?
No.
Okay. Have you had any vision changes?
Mm-mm.
Do you wear glasses at all?
No.
Do you remember last time you got your vision checked?
Probably a year ago.
Okay. We'll recheck that today.
Okay.
Do you have any like blurry vision at all? Any double vision? No. Okay. How about your ears? Do you have any pain in your ears?
No.
No. Any discharge that you've noticed?
Mm-mm.
Okay. Any ringing in your ears?
No.
Okay. Any like feeling like the room's spinning sometimes? Okay. How do you any hearing loss or anything?
Mm-mm.
And then your nose, any congestion?
Mm-mm.
Any runny nose?
No.
Bleeding, nosebleeds at all? Okay. I feel like how is your breathing through your nose
Good.
feel?
Yeah.
Okay. And then with your mouth, any pain with chewing?
Mm-mm.
Any soreness in your throat?
No.
Any sore tongue at all or anything? No. Any decaying teeth?
No.
Missing teeth?
Mm-mm.
No. Okay. And then how about your neck? Any like swollen or tightness in your neck?
No.
Any bumps or anything that you've noticed?
Mm-mm.
And now your breasts. Any tenderness in your breasts?
No.
No. Are you doing self-examinations to check for anything?
No, not really.
Okay. It'd be good for you to maybe just kind of feel around in like a circular pattern or something to get all the breast tissue just to feel if there's any like abnormalities. Okay. Any discharge out of, that you've noticed from your breasts?
Mm-mm.
Okay. Have you ever had a mammogram or anything like that?
No.
Okay. And then any cough? Do you have any like pain with breathing?
No.
Any like shortness of breath at all?
Mm-mm.
No. Okay. And chest? Do you have any chest pain where your heart's at?
No.
Any feelings like a chest pain that comes and goes, maybe with exercise or anything? No. Okay. Any feeling of like your heart beating really fast or like it skips a beat or something?
No.
Okay. Do you ever have like any activity intolerance where you can't maybe work out as hard as you want to because any history of fainting at all or anything?
I have just when I'm anxious or like getting blood taken, but nothing serious.
Okay. Have they ever checked out your heart for that?
They checked it, yeah.
Okay. Did everything come back looking okay? Okay. Have you ever had an EKG before where they check the rhythm with the electrodes? No. Okay. All right. Very good. How about your stomach? Have any stomach pain? No. Any pain like after eating or history of stomach ulcers?
Mm-mm.
No. Okay. Any changes in your stool at all that you've noticed? Any blood? How about any nausea or vomiting? And then your like urine and stuff. Have you been able to urinate okay and everything? Any pain with urination? Any foul smelling urine? Okay. Any pain in your like kidney areas at all or anything like that?
No.
My stethoscope. Any and then any like how your periods been, your menstrual
Regular.
cycles? Okay. Any concern with that at all? Any abnormal discharge? Pain? Okay. Have you had do you remember when your last pelvic exam was?
No, I have to schedule that soon.
Okay. That's good. And you're 21, right? So you can get in soon and just get that figured out.
Yeah.
They'll check you out. And then any history of like seizures, dizziness? No. Any like muscle pain?
No.
Fatigue? Feeling weak at all?
No.
No. Any history of like a blood transfusion or anything like that? No history of anemia, low blood cells, things like that?
No.
Any and we talked about your hypothyroidism, so have you noticed any like cold intolerances or weight gain? Any increased appetite or thirst? Very good. And you said no problems with sleep, not waking up irregularly in the middle of the night to have to urinate, anything like that?
No.
Okay. Very good. And then also any psychiatric history, feeling like anxiety, stress. How are you coping with stress?
Mostly exercise.
Okay.
Yeah.
Okay. Very good. Do you feel like that's working for you?
Definitely.
Okay. Do you feel stressed or managed?
I mean, just a normal amount, not like chronic stress.
Okay.
Yeah.
Do you have any desire to kill yourself?
Mm-mm.
No. Any desire in the past?
Mm-mm.
No. Okay. All right. Very good. Let's move on to doing assessments now. Okay. So I'm gonna start by palpating your head. I'm also gonna look at your hair. Very good. I'm going to assess your face and palpate right here. I'm going to palpate right here as well. I'm going to palpate your frontal sinuses and your maxillary sinuses. That's good. I'm going to, while I'm doing this, I'm going to listen to your arteries on the side right here. Very good. I'm gonna have you touch your cranial nerve number 7. I'm gonna have you smile, puff out your cheeks, frown. Very good. Good frown. Good job. And then I'm gonna have you just open and close your jaw. Palpate right here. Good. Cranial nerve 5. Very good. Okay, I'm gonna test some of your sensation for your face. This is going to be sharp, and this is going to be dull. Okay, so you just close your eyes and you tell me what it is.
Sharp. Dull. Sharp. 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 Dull.
Very good. And then I'm going to test with this light touch, okay? So it's going to feel like that. And I'm going to have you close your eyes again. You tell me when I'm touching you.
Yep. Yep.
Very good. Okay, now I want to move on to your eyes. I'm going to have you look straight. I'm just going to check your cornea. Make sure that stuff all looks good. Very good. I'm going to check under your eyes for any redness or anything, looking at the tear ducts, making sure those look good, and your eyelashes go the way that they should. I'm gonna check your eye alignment, draw just a line right there, and that looks good as well, okay? I'm gonna have you look at me, and I'm gonna check to see how your eyes react to the light. Very good. Good. I'm gonna have you focus on an object that's far away, and then when I say look at me, I'm gonna have you look at me, okay? Go ahead and look at me. Very good. Next, I'm going to look in your eyes, okay? So I'm gonna have you look straight ahead. Very good. And I'm gonna do the same over here. Okay, very good. Now, I want to check your cranial nerve number 2, so I want you to stand up, and I'm going to have you stand right here, and have you cover one eye with this, and we're going to read this sign, read the lowest line that you can, okay?
CFDHJ.
Very good. I'm going to have you switch it, and then if you can read the same line, read it backwards, but pick any line that you can, okay?
JHDFC.
Very good. 20/25 vision. You can sit on back down. Okay, I'm going to check your oculomotor function, so cranial nerves 3, 4, and 6. I want you to look right at my finger and just follow it with your head, with your eyes, excuse me. Go ahead. Very good. All the way up, all the way down. Very good. Next, I'm going to have you close your eyes nice and tight and raise them. Cranial nerve number 7 again. Good. And then raise your eyes one more time. Very good. Okay. Now that we're done with that, I'm going to move on to your ears, okay? So I'm going to palpate your ears and inspect them. Pain, tenderness back here. Discharge. Okay. I'm going to look in your ears. I'm going to pull this up and back. Very good. Looks pearly gray and everything. No issues there. Very good. Okay. Since I'm back here, I'm going to have you put a finger in your ear and wiggle it. I'm going to do the whisper test. And I want you to tell me the 3 letters or numbers that I say, okay? 7,
7,
8,
8,
4.
4.
And I'm going to have you do the other one.
5,
7,
7, 3.
Very good. Okay. Now that we're done with that, I'm going to move on to your nose. Okay. I'm gonna palpate your nose and see how we're doing. Looks to be in line. Yes. Take a look up in here. Turbinates in your septum look good. No deviation, which is good. Doesn't look like you're struggling to breathe through your nose at all, huh?
Mm-mm.
Very good. I'm gonna look in your eyes now, okay?
Mm-hmm.
So, we're gonna circle back to your ears. I'm gonna do the Rhine and the Weber test, okay?
Mm-hmm.
So go ahead and tell me if you hear it in your right ear or your left ear or both equally, okay?
Both equally.
Very good. I'm gonna put this on your bone, and when you can't hear it anymore, tell me and I'll switch it and I'll put it next to your ear, okay?
Mm-hmm. Now. Now.
Very good. Okay. To the other side.
Now. Now.
Good. Okay. Now let's go back to your nose and your mouth, okay?
Mm-hmm.
So I'm gonna look into your mouth. I'm gonna have you open up nice and wide. Very good. Just checking cranial nerve number 9. When you say ah, that uvula does go back. I'm gonna look on the sides of your tongue, okay? I'm gonna push this to the side. And this side. Good. Just checking some of these teeth around here. Very good. Go ahead and bring your tongue to the roof of your mouth. Very good. Looks good. I'm gonna have you clench your teeth. I'm gonna feel this again. Good. Now open your jaw all the way up. Very good. Close it. Good. And cranial nerve number 5. That's very good. Have you stick out your tongue. Cranial nerve number 12. Strength looks good and everything. Okay. And now I want to move to your neck, okay?
Mm-hmm.
So I'm going to do your lymph nodes. This is your preauricular lymph nodes, postauricular lymph nodes, your occipital lymph nodes, and then I'm going to move to your tonsillar lymph nodes, your submandibular lymph nodes, your sub, and then up to your submental lymph nodes, okay? And then I'm going to feel for your by your sternocleidomastoid muscle, I'm going to feel your superficial cervical lymph nodes, your posterior cervical lymph nodes, and then also your deep cervical lymph nodes. And don't feel anything, that's good. And then your supraclavicular lymph nodes. Okay. Okay, very good. Now I'm going to inspect your neck. I'm just going to look at it. Looks like you got some water right here.
Mm-hmm.
Can you go ahead and tilt your head up just slightly and then take a sip of water and drink it for me? Good. Just gonna palpate around here. Feeling it. Trachea feels midline. No tugging or anything. Very good. I'm going to palpate your thyroid. I'm gonna push it over here just a little bit. I'll try to feel for it. Feeling anything? Good. I'm gonna have you take a sip of water. I'm gonna have you hold it in your mouth. And when I say swallow, go ahead and swallow. Good. Okay. I'm gonna do the same thing over here. Go ahead and take a sip. And go ahead and swallow. Okay. Very good. Yeah, palpate it. That is good. I'm gonna test your range of motion. This is going to help test cranial nerve number 11, okay? So go ahead and look to your left, to your right, up, all the way down. Very good. I'm going to have you turn your head against my hand. Good. Good. And then I'm going to have you raise your shoulders, bring them down, raise them up. Good. Nice and strong. Okay. Now that we're done with that, I'm going to move on to doing your lungs, okay?
Mm-hmm.
So first I'm going to look at how your breathing is. Let's see. Very good. I'm gonna palpate just the structures of everything to make sure everything feels good and is even. While I'm back here, I'm gonna palpate your spine as well, okay? No pain or tenderness, okay? Palpate each of your spine. Very good. I'm gonna palpate the front. Good. I'm gonna have you lean forward a little bit and cross your arms. Have you take a deep breath. Just to make sure it expands symmetrically. Good. And I'm gonna do the front as well, okay? I'm just gonna put my hands right here and then go ahead and breathe. Very good. Now I'm going to percuss your back, okay? So go ahead and lean forward and cross your arms just slow slightly. I'm just gonna have, can you lift up your sports bra just a little bit for me? Good. Good. I'm gonna have you lift your arms straight up at the sides. I'm going to percuss the sides right here. I'm just gonna have you lift that up just a little bit more. I'm gonna do the same thing on this side. I'm gonna do 4 on each side. Come back. One more right here. Very good. And now I'm gonna percuss the front. I'm gonna percuss down over here. Very good. Now I'm gonna listen to your lungs in the same way that I just percussed, okay? So go ahead and breathe just normal, nice and normal for me. Very good. 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 Have you lift your arms up. Breathe. Nice, normal and deep for me. Good. Same on this side. Good. You can put your arms down and listen in the front. Okay, very good. Now I'm going to ask you to say 99, and I'm just gonna feel the vibrations, okay? So go ahead and say 99.
99.
Go ahead and lean forward a little bit for me, please.
99. 99. 99.
And do the same in the front.
99. 99. 99. 99.
Okay, very good. Okay, now I'm gonna move on to your heart. Okay, so I'm gonna have you lay over here. One over. I'm gonna have you lay down on your back. And I'm going to look with my light again, just to see if there's any. Can you pull this bra up just a little bit for me? Good, I'll keep you covered. Okay. I'm just gonna look to see any heaves or any irregular beats or anything. I'm gonna palpate right here, trying to find pulse. Good. Good. I'm not feeling anything irregular. Good. Okay, now I'm gonna listen to your heart. Listen with the diaphragm first. And I'm gonna listen to your pulmonic valve. And then aortic. Or sorry, your aortic valve is first. And now I'm gonna listen to your pulmonic. Your tricuspid. your mitral valve. Very good. I'm going to switch it and listen again. Aortic, harmonic, cuspid, and your mitral. Good. I'm going to have you lay on your left side. Okay. I'm going to do the same thing again on this side like this. Good. And do this again. Oh, excuse me. Good. And then I'm going to have you now sit up. Okay. And I'm going to have you lean forward just ever so slightly. I'm going to listen again. Very good. Listen right here. Thank you. Very good. One last time. Okay, very good. Awesome. I'm going to have you lay back down and I'm going to do your stomach examination now, okay? Actually, I'll ask you if you want to come lay over here. It'll be a little bit easier for us. Very good. Okay. Let's stand over here on your right. I'm just going to look at your stomach. Thank you. Good. We'll keep you covered. Just looking. I'm going to stand up here and inspect it. No abnormalities that I'm seeing. Okay, now I'm going to listen to your stomach. Start right here. Yep, bowel sounds sound active. I'm gonna also listen to you over your liver. Anything? Listen over your spleen. Okay. I'm also going to listen to your abdominal, to your aorta. Okay. I'm going to listen to your renal arteries, your iliac arteries, and then I'll keep you covered. I'm going to listen to your femoral arteries as well, okay? It's right in here. Very good. Since I'm down there, I'm going to just try to palpate for your pulses, your femoral. Good. Excuse me. Okay. Very good. Okay. Now I'm going to do percussion throughout your stomach. Okay. So it's going to come through here. Very good. I'm also going to percuss your liver. I'm going to percuss on your spleen. Very good. Okay, I'm going to try to feel for your liver now, okay? So I'm just going to put my hand right back like this. And I'm going to ask you to take a deep breath in, okay? Go ahead and exhale. Okay. Okay, I'm going to also try to feel for your spleen a little bit, okay? Go ahead and take a deep breath in. And exhale. Good. Any pain with that tenderness? Okay, good. Before we keep continuing with some of that deeper palpation, I want to check just with some light palpation. Just feeling about an inch, a centimeter deep, just to see any pain, discomfort there. Okay. Now I'm going to go a little bit deeper. It can be normal to feel some discomfort over some of these spots, so just let me know. It'll take a shot.
Yeah.
Oh, very good. Okay, now I'm gonna measure for your liver. Okay, I'm gonna start right here. Okay, mark this. Sorry, you're gonna get a little bit of marker on you. And I'm gonna press down. Right there. Very good. About 8 centimeters, okay? Very good. Okay. Now I'm going to have you sit back up, okay? And you can cover yourself back up. Oh, hello. I'm gonna come back over here. I'll have you sit back down, okay? I'm gonna go through, I'm gonna start to go through your upper body and extremities, okay? So just gonna feel around the musculature and everything. Skin looks good. Also, any mold changes that you notice or skin changes?
No.
Okay, good. Can you tell me what year it is?
2024.
Okay, can you tell me what the date is?
June 18th.
Very good. Okay. All right. I'm gonna start by palpating all this. I'm gonna palpate for your pulses. Okay, your brachial pulse. Good. Your radial pulse. Your ulnar pulse. Very good. I'm gonna do the same over here. Good. Very good. Yeah. Feels good to me. I'm going to palpate your elbows. Good. Good. Okay, let's do some range of motion. Let's do these, palpate these guys, and then we'll move and do some range of motion and stuff. Check your capillary refill. Nice little tan line right there, huh?
Yeah.
Okay. I'm going to check the capillary refill on here. Looks like all good. Very good. I'm going to have you spread your fingers apart, spread them together. Go ahead and point your fingers down. Keep your wrists nice, good. Flex them up. Good. Now I want you to tap all your fingers together. Good. Make a fist. Very good. All right. And now I want you to do with your wrists. I want you to point them down at your wrists and point straight up. Good. I'm going to check that strength too. Good. And then go ahead and push it down. Very good. I'm going to have you put your hands out like that. Point them in. Good. Very good. And then I'm going to have you bring your arms out to your side. Good. And then now bring them all the way up. And now I'm going to test your strength. Go ahead and push against my arm. Loosen this a little bit and curl up. Good. Same on this side. Go ahead and push against my arm. And then curl up. Good. And now bring your arms all the way out to the side. Go ahead and try to pull down. Push up. Very good. Go ahead and reach your arms straight over your head. And now act like you're lounging. Bring them behind. Good. And you can bring them down. And now I want you to bring your arms behind your back. Very good. Okay. Next, I want you to, I want to check your range of motion of your lower extremities and all that good stuff. So I'm going to have you lay over here, okay? Okay. Here's this if you'd like to cover up top. Okay, I'm going to have you bring this leg straight up in the air. Go ahead and bring it down. Bring that leg straight up. Very good. Okay, and then I'm going to have you put that leg straight in the air a little bit. Don't let me bend your knee. Good. And then this again. Bend your knee. Very good. I'm gonna have you bring your knee all the way up to your chest. Good. And then try to bring that one all the way up. I'm gonna have you bring this leg out to the side. Now cross it over across your body. And I'm gonna have you push against my arm back. And then when you bring it back out here, I'm gonna have you push against my arm in. Very good. Same thing on this side. Good. And all the way across. Go ahead and push against my arm. Good. And then go ahead and push against my arm. Very good. I'm gonna have you bring your knee up and just set it there. And then don't let me push it down. Good. And same thing over here. Okay, very good. I'm gonna have you turn onto your stomach real quick. Okay, go ahead and raise this leg up for me. Good. And go ahead and raise this leg up for me. Very good. Okay, you can now turn back. Well, why don't you bring your knee up? Let's see how that looks. Good. And then go ahead and bring your other knee up. Very good. Let's test some strength right here while we do this. Go ahead and bring that up. And then go ahead and kick against it. Good. Go ahead and bring it up. Go ahead and kick against it. Good. You can roll on back over. Okay. You can sit up now. We'll come back over here. Okay. Now I want to test some sensation on those arms and also your reflexes. Okay. So this is going to be again sharp and then dull, and I want you to close your eyes and point to where you feel it. Okay.
Sharp. 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 Dull. Sharp. Sharp.
Okay, very good. Now I want to do the same thing with this, light touch, okay? So this is going to be light again, okay? I want you to tell me when you feel it.
Yep. Yep.
Okay, very good. Now let's check your bicep reflex, okay? So, very good. Check over here. Very good. I'm going to check your brachioradialis reflex. Very good. Very good. Arms are jumping. I'm going to check your triceps. Go ahead and relax this tricep. And then, very good. And then I'm going to do it over here as well. Go ahead and relax that tricep. Very good. Okay. Now that we're done with that, I'm going to move on to your lower extremities. I want to test sensation again, okay? So this is going to be sharp, and this is going to be dull, okay? So tell me.
Sharp. Dull. Sharp. 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 Dull.
Very good. And we'll do light touch again, okay? So again, this is going to be light.
Yep. 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 Yep.
Okay, very good. All right.
Did a long pause there.
Yeah, got me nervous. All right, so I'm gonna check your range of motion of these legs. Let's do your patella reflex first. Very good. Nice. Okay. I'm gonna see your Achilles reflex. Very good. Pushing nice and down. Very good. Go ahead and bring those feet up to the sky. Point them all the way down. Go ahead and curl those toes. Spread them. Good. I'm gonna palpate up your legs and everything. Palpate these toes. Any pain in here at all? Okay. Palpate all this. Feel around. Bones are good. Palpate this guy. Got some scars on here. Very good. I'm gonna feel your popliteal pulse, okay? Feel up in here. Okay, very good. I'm gonna feel your posterior tibial pulse right here. Okay. That's good. I can feel it. Well, Some people don't have these pulses.
I know we did a lab where we had to find them. It was hard.
Yeah, sometimes it can be hard. That one's a little bit more difficult to find. And your dorsalis pedis. Okay, very good. Okay, well, I'm down here and we're checking sensation. I want to check the sensation of your bottom foot, okay?
Mm-hmm.
So just tell me if you feel any poking.
Mm-hmm. Mm-hmm. Yep. Yep.
Okay, I'm gonna do the same over here.
Yep. 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 Yep.
Okay. I'm gonna mess with your toe, okay? So I'm gonna tell me if it's up or down. Go ahead and close your eyes. Okay.
Up. Down. Down. Up.
Okay. Very good. Go ahead and move your feet out like this and turn them in. Good. And go ahead and like move your legs out like that way a little bit more. Good. And then turn them in. Good. And then I want to check your strength. Go ahead and lift them up and push them down. Very good. Okay. Now I want to check your fingers. I want to see same thing. I'm going to move one up and one down. So close those eyes.
Mm-hmm.
Tell me if it's up or down.
Up. Down. Down. Up.
Okay. Very good. Okay, so now I want to check some more neurological stuff, okay? I want you to close your eyes, and I want you well, actually first open them. I want you to put your arms out to the side, and I want you to bring your finger to your nose. And now close your eyes and do it, okay? And then I want you to slowly speed it up. Very good. Looks good. Next, I want you to make some like padding on your side. I want you to start like that and then slowly go quicker. Very good. Now I want you to bring your heel to your top of your shin, and I want you to run it down and up and down your shin. There you go. Now switch it to the other one. Good. I'm gonna have you stand up now.
Mm-hmm.
We're gonna do the Romberg test. I'm gonna have you stand with your feet apart and then close your eyes. Stand here for support. Very good. Okay. Now I want to see how you walk. Okay, so go ahead and just kind of walk that way and then come back. Good. And now I want you to walk on your tiptoes. Very good. And then walk on your heels when you come back. Okay, very good. Let's check how your spine's doing. I know I palpated your spine. We felt that, but I want you to bend over now at your waist. Touch your toes if you can. Very good. And then come up slowly. Pause halfway and then all the way up. Good. Now I want you to lean to your side, to your right side, or your left, yep. And then to your right side. Very good. And then I want you to do like a twisty. I'm going to stand behind you and stabilize your hips, but I want you to twist. Very good. How's that feel?
Good.
Okay, very good. All right, well, I think that we did just about everything. Do you have any questions or anything? Okay.
Mm-hmm.
Well, awesome. Thank you so much, Morgan, for doing this with me, and thank you for everyone watching. Thanks.